Apixaban, sold under the brand name Eliquis, is an oral anticoagulant or blood thinner used to reduce the risk of blood clot formation. It is prescribed for stroke prevention in non-valvular atrial fibrillation, treatment of deep vein thrombosis and pulmonary embolism, prevention of recurrent DVT and PE, and prophylaxis of DVT post-hip or knee replacement surgery. Common side effects of Apixaban include bleeding in the form of epistaxis, hematuria, and bruising, anemia, and nausea. Serious side effects include intracranial hemorrhage, gastrointestinal bleeding in severe cases, and rarely hypersensitivity reactions. Apixaban selectively inhibits factor Xa, an enzyme in the coagulation cascade responsible for the conversion of prothrombin to thrombin, therefore reducing thrombin generation and blood clot formation. It acts independently of antithrombin 3 and does not require routine coagulation monitoring. For atrial fibrillation, the standard dosage is 5 mg orally twice daily. The dosage should be reduced to 2.5 mg twice daily if the patient has more than 2 of the following: age of more than 80 years, body weight of less than 60 kilograms, and serum creatinine greater than 1.5 mg per deciliter. For the treatment of DVT and PE, 10 mg twice daily for 7 days, then 5 mg twice daily. For the prevention of recurrent DVT and PE after 6 months of initial treatment, 2.5 mg twice daily. For postoperative DVT prophylaxis and hip replacement, 2.5 mg twice daily for 35 days is prescribed. After knee replacement, 2.5 mg twice daily for 12 days. It is initiated 12 to 24 hours after surgery. CYP3A4 and P-gp inhibitors such as ketoconazole and ritonavir increase Apixaban levels, resulting in higher bleeding risk. CYP3A4 and P-gp inducers such as rifampin and carbamazepine reduce efficacy of Apixaban. Other antiplatelet agents increase risk of bleeding with Apixaban. There are some precautions to consider when using Apixaban. Higher bleeding risk in patients predisposed to bleeding. Caution is advised. Risk of hematoma formation and potential paralysis with spinal or epidural anesthesia. Dose adjustments required in moderate renal impairment and contraindicated in severe cases. It is not recommended for patients with prosthetic heart valves. Caution is advised during pregnancy and breastfeeding unless benefits outweigh risks. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.